Please welcome Nicolette Lewis-Saint, Senior Vice President of Policy and Strategic Planning at the Healthcare Distribution Alliance, and Sarah Wells Cosi, the Director of the Center for Public Health at the Milken Institute, for a sponsor perspective presented by the Healthcare Distribution Alliance.
Good morning. It's great to be here and see so many of you in the audience and online. Nicolette, I'd like to start by talking about how we met. We met during the very early days of the COVID-19 pandemic. At that time, you were the executive director of Healthcare Ready, and you were literally working at the nexus of public and private sectors with a focus on ensuring that people had access to medicines during emergencies. Today, you're heading up policy and strategic planning at the Healthcare Distribution Alliance. So I'd like to start the conversation today with you talking a little bit about who HDA is and how they impact patients' lives. And the reason that I want you to start there is because I think that when people think about healthcare in the traditional sense, they think of doctors, hospitals, clinics, and there are distributors that are really critical to the healthcare ecosystem, but they operate largely behind the scenes. So if you could also talk a little bit about who are distributors, what are their role, and what do they do every day for patients?
Absolutely. Thank you, Sarah, and thank you to the organizers. HDA is so pleased to sponsor this event. So yeah, you're right. When we first met, I think it was behind a Zoom screen talking about responding to COVID and the importance of partnerships. So in some ways, a bit of a transition, but in a lot of ways, just continuing that theme. I'm really proud to work for HDA because HDA is a national organization that represents healthcare distributors. And to your point, that is not a part of the healthcare ecosystem that we talk about day in and day out. But healthcare distributors do the work of ensuring that more than 11 million medicines, medical products are delivered to facilities every day. So as I think I mentioned in our first conversation and would bring up here, when we think about what healthcare delivery looks like, we think about the facilities, but without the staff, without the stuff, without the supplies, it's a building. And so what healthcare distributors do is to make sure that those more than 300,000 facilities that depend on having medicines and medical supplies every day have those supplies when they need them on time. And because of the work of distributors, we really focus on operational efficiency. How do we consolidate the process of getting more than 1,400 manufacturers to get those products to those facilities every day? So they're the logistics experts. They're the folks that are thinking about everything from how the product is safely and securely delivered to how to make sure that the roads that may be closed don't create a delay in the delivery.
Thank you. So in my role at the Milken Institute, I work in our Center for Public Health. I've had this great fortune to work with HDA and you over the past year, and it's been really incredible. We studied how the pharmaceutical supply chain supports public health broadly, both during emergencies and non-emergencies. Now, we did a ton of research. There was a lot of key insights and recommendations that came out of a report that was released this spring. But we ended up focusing on three key areas: health equity, trust and communication, and public and private partnerships. From all of that work, what stood out to you in what we heard?
So I thought this project that we did was really important because it really was the first time that we looked at the relationship between the pharmaceutical supply chain and the community. Oftentimes we think about the supply chain kind of ending with the facility, but this was where we said, no, it's provider to patient, and with this patient as a part of a community, and what is our relationship there? And so when we were thinking about those three themes, I think what really jumped out to me was the fact that when you think about the three themes, they're so interrelated. And in some ways, the partnerships, the trust and communication, these are things we've been talking about for a while. I'm really thrilled to continue to see equity be such a big part of the national discourse around healthcare delivery. But they are so connected, and when we are thinking about how we actually advance resilience, a lot of times we're forgetting that piece, that last mile to the community. And so what really stuck out to me in the just in the discussions, the research, as well as the report, was the fact that we were thinking about themes that have been discussed previously, but in really new ways. We're thinking about public-private partnerships that were not about community to community, like not about the local health department making sure that this church was a part of the discussion, but really how do healthcare distributors, how do pharmacists have those conversations with those anchor institutions? We were upending the idea that an anchor institution has to be a facility that, a major health system or a large institution. It was really the idea that an anchor institution could be the grandma in the community that everybody listens to because they know if they don't listen to her, it's going to be a problem. And that, I think, was a really important piece of this because we were showing how so many of those connections were the difference in people getting vaccinated or not, or knowing where to go for a vaccine or a COVID therapeutic. So for me, it feels like the start of a conversation. And I hope that as we settle into, whatever this post-COVID world looks like, we are able to actually take those learnings and think about how they help us to be better for the next phase.
Well, let's talk a little bit more about that. I think we are in the post-pandemic landscape now. And so I would really love for you to talk a little bit about how the supply chain is adapting to this short-term kind of aftermath, especially with the public health emergency unwinding. The declaration expired on May 11th. How are things going?
They're still going. And I think that's the beauty of what the supply chain does. We are still continuing to deliver COVID vaccines and therapeutics to facilities. We're still making sure that we are not losing the lessons that we've learned over the last few years. And we're tracking the flexibilities, things like telehealth flexibilities that have been extended, and what that means for not just what product is going to be needed, but where it's going to be needed. But the work continues, and for us, we're at the point where we're starting to think not just about, what happens with the public health emergency transition, but how do we make sure that everything that we've learned and all of these different elements of the different phases of the COVID pandemic translate into what we need to do next to prepare for the next crisis.
Great. Well, I know you focus a lot on policy. Yes. And so we can't just focus on the short term. We have to look at the long-term view. So what are your thoughts in terms of what is needed in the policy realm in order to ensure that we have a resilient supply chain going forward?
So I think to start, we really have to make sure that the legislation that is in place, or the must-pass legislation that has to be done within this Congress, gets done. So for starters, we have the Pandemic All Hazards and Preparedness Act, which is must-pass legislation that does a really important job of making sure that the infrastructure that needs to be in place for us to be able not just to respond to emergencies, but also to prepare for them and to make sure that the different components and authorities that are necessary within the federal agencies are very clear so that we are doing that work on a continual basis. That reauthorization is critical in our minds. Part of what we are thinking about is making sure that this reauthorization, so the last reauthorization happened right before COVID. So what this can't be is just everything we've learned from COVID and forgetting, all of the other threats, all of the other risks that we have to manage. But what it should be is an opportunity for us to say, what did we learn here? What really worked? What were missed opportunities? How can we improve? But how do we really stay focused on the elements of supply chain resilience that need to be in this legislation to make sure that we're not putting ourselves at a deficit for the next thing that's coming, because certainly there will be something else.
Okay. So last question. I think it's obvious that the healthcare supply chain is tested every single day. In the past year, we've unfortunately seen some shortages of critical medicines. Last autumn, we saw shortages in children's antibiotics, for example. In recent months, there's been some shortages for oncology treatments for cancer patients. Can you explain to all of us, like, what's going on here, and where does your organization and your sector fit into all of this?
Sure. So as quickly as I can.
Okay.
So there are a lot of things going on. To put it one way, if you've seen one shortage, you've seen one shortage. So the different elements that may be the drivers of those shortages, we have to be careful to not put a broad stroke and say, you know, they're all caused by the same phenomena. But part of what we are seeing is that there is a supply set of drivers that may mean that we have to look at how we're thinking about resilient manufacturing, or thinking about how we are thinking about diversification of the supply. But there's also a demand side that we have to also think about, which is what happens when there's a sudden surge. We think about it as medical surge, and thinking about a sudden surge and saying, whether it's, you know, a celebrity saying, hey, use this product, or a legitimate medical surge related to, you know, in December we saw the RSV flu COVID surge. But there are multiple drivers. Part of what distributors do are to track those patterns. Part of where we are really interested in partnering is to think about public health surveillance as an opportunity to be able to see when those spikes might happen and be able to plan and react more rapidly. But also a part of our strategy is ensuring that the product that is on hand is allocated in a manner that ensures that there's equitable distribution. And so what that means to us is that we have to make sure that it's not just about who can get the most product, but who needs product, and how do we make sure that those shortages are not creating negative health outcomes.
Well, thank you.
Thank
I can
you.
feel your passion. You're a wonderful leader. It's very refreshing. So thank you so much for your insights and perspectives.
Thank you for having me.